breast cancer can turn your world upside down, but breakthroughs in treatment are helping to transform this type of cancer into a manageable chronic disease. Oncologist Dennis Citrin, MD, with Cancer Treatment Centers of America, explains what he tells his patients about living with late-stage breast cancer. A. The modern approach to treating advanced breast cancer is to turn it into a chronic illness. We can do this today because we know an increasing amount about how breast cancer develops and grows. These research breakthroughs are, in my opinion, the biggest advancements in breast cancer treatment in the last 20 years. Today, patients can live with breast cancer just as people live with chronic illnesses like diabetes. Every day, a diabetic gives herself a shot of insulin or pops a pill to control her diabetes. She isn't cured of the disease, she's still diabetic, but her disease is under control. It's not going to kill her and it's not going to significantly impair the course of her life. This is the way we approach advanced breast cancer today, to turn it into a chronic illness the patient can live with while at the same time maintain a good quality of life. With most women, we can do this for many years. Shirley is not letting her metastatic breast cancer get in the way of living her life. Her diagnosis was devastating. Now she focuses on staying active and helping others. Medical reviewer, William C. Lloyd III, MD, Facts last review date, 2018 April 25, 2018 Healthgrades Operating Company Incorporated all rights reserved. May not be reproduced or reprinted without permission from Healthgrades Operating Company Incorporated. Use of this information is governed by the Healthgrades User Agreement. A. There is no single entity known as breast cancer. There are different types of breast cancer that need to be treated differently. The biology of the disease determines the treatment we offer. We find out what type of breast cancer the patient has. We do this by identifying how the cancer cells grow, so we can stop that process at the root. Cancer cells may use the reproductive hormones, estrogen and progesterone, to multiply, and they may also grow using a protein called human epidermal growth factor 2, HER2. Breast cancer cells may use both hormones and HER2 to grow, or just one of those, or neither of them. By understanding what makes the cancer grow, we can use treatments that block these processes to stop the cancer in its tracks. When breast cancer cells use your reproductive hormones to grow, it's known as hormone receptor positive, HR positive, breast cancer. This means your cancer cells are sensitive to estrogen, progesterone, or both, and use receptors on those hormones to propagate. If the cancer doesn't use estrogen and progesterone hormones to grow and spread, we call it hormone receptor negative, HR negative. When cancer is HR positive, we use hormone therapy to block the cancer cells from using the estrogen or progesterone. When it's HR negative, we must turn to other options. We also look at how the cancer cells respond to HER2. HER2 is a special protein that breast cancer cells may use to grow and replicate. If your cancer is HER2 positive, the cancer cells are using HER2 to grow. If it's HER2 negative, there are other factors boosting the cancer, so we won't use treatments that target HER2. HER2-positive breast cancer makes up about 20% of all breast cancers, and it's known to be more aggressive, rapidly growing, and more likely to spread than HER2-negative breast cancer. However, we now have very potent drugs that specifically target the HER2 protein, so there are many options to treat it successfully. If your cancer doesn't respond to estrogen or progesterone, making it HR negative, and also doesn't use HER2 to grow, so it's HER2 negative, we call it triple-negative breast cancer. In these cases, the targeted treatments are not going to be beneficial, so we generally treat with chemotherapy. This content does not provide medical advice. This content is provided for informational purposes and reflects the opinions of the author. It is not a substitute for professional medical advice, diagnosis or treatment. Always seek the advice of a qualified healthcare professional regarding your health. If you think you may have a medical emergency, contact your doctor immediately or call 911. Dennis Citrin is a board-certified oncologist specializing in breast cancer treatment with Cancer Treatment Centers of America at the Midwestern Regional Medical Center. He is the author of the book, Knowledge is Power, What Every Woman Should Know About Breast Cancer. View his Healthgrades profile. Greater than copyright 2018 Healthgrades Operating Company Incorporated. All rights reserved. May not be reproduced or reprinted without permission from Healthgrades Operating Company Incorporated. Use of this information is governed by the Healthgrades User Agreement.